that working? Okay, recording. Okay, so today is Thursday. We are doing EKGs today. So fall 2008, Bio 208. All right, I got my cheat sheet. So in Wednesday's lecture, we went through, again, the conduction system of the heart. So we have our hearts, right? Right atria, left ventricle, and right ventricle. And remember, we have this SA node, and then we have those internodal pathways, and then we have our AV node, and then we're going to, in the septum, we're going to have our bundle. It's going to branch, and then it's going to scoosh out at the end into our Purkinje fibers, okay? And what we're going to do with the EKG is we are going to capture, remember that our nodal cells, their action potentials look like this. Our contractile cells, they look like this. We are going to capture in an EKG, instead of one cell's change in membrane potential, we're going to capture lots of cells in the same time frame working together to depolarize rapidly together, and then together go through repolarization, all right? And so when we look at an EKG, okay, all right, we have a line, we see usually a P wave, we see a QRS, and then we see a T wave. And that's usually represented, the four waves, a P wave, a QRS, and a T wave. That usually represents one cardiac cycle, seeing those four waves or three waves, okay? Now, when we're measuring a lead 2, we are going to be measuring, again, negative changes to positive changes from the right arm to the left leg. And the measurement in that plane and in that direction should let us capture all of the depolarization of all of these cells at the SA node and kind of here. We're going to capture all of those cells going through this phase 0, phase 0 rapid influx of positive ions. And so we're going to see that the depolarization of all of these cells is going to start to show on the main measurement across the organ that a bunch of cells in this region have started to rapidly depolarize, okay? And we're going to see that around the middle of the P wave, chances are that depolarization has gone through enough of the atrias that if we were to then go to that cardiac cycle, what would we start to see the atrias physically start to do? Enter their systole and start to contract. Okay, and so that P wave is going to, again, be the capture of all of these nodal cells and all of these contractile cells going through their phase 0, 1, and 2, which is a point in time on each cell that there's depolarization happening, right? And collectively, we're capturing all that depolarization here. And then we should start to see, again, following electrical events, we should then start to see those physical events. And so right around this point in the middle of the P wave, if we were doing a cardiac cycle, that would probably be when the atria starts into systole. Okay? Now, when we get to that AV node, we know there's a little bit of a delay. Okay? So the atrias are going to start to, again, repolarize, and when atrias are repolarizing over here, stage 3, remember potassium is going out, right? And so again, we're starting to see a little bit of their repolarization, a little bit of their change back to a membrane potential near resting levels, okay? But very quickly, we start to see another rapid rise in depolarization of cells. And we see them happening more cells and more quickly. So we see that this Qrs complex is occurring. And the Qrs complex is when we know that our ventricular cells are starting to depolarize. Okay? And so now these things are happening phase 1, phase 0, phase 2 in the interventricular septum at the apex of the cell and throughout the ventricles. And remember, how big is the mass of the left ventricle? It's huge. So there's a lot more cells, thus why we potentially see that big, tall spike. And these cells, again, are doing this depolarization almost instantaneous with each other. So we see that the timing of them getting depolarized is really, really quick to each other. Okay? So what we should expect to see kind of around the middle here is when, again, the ventricles go into their systole. Okay? Now, somewhere in here, the atria did fully repolarize and reset. And so the majority of their cells, again, stage 4, nothing's happening.
At the same time that the ventricle repolarizes, the atria repolarizes.
Right. So do you see the atria truly have a matching upside down wave to the P wave? No, because it's masked by the ventricles depolarizing. Okay, so one of the reasons why we don't see atrial repolarization as its own entity is because the ventricles should be depolarizing when the atrias are repolarizing. And there's so many more ventricle cells that, guess what? They're going to hide it. They're going to mask it.
And it all happens during the Qrs complex.
Yes. Okay. All right. Now, eventually, again, we are going to get to a place where all of these cells in the ventricles are going to go through their phase 3 and they're going to get back to their phase 4. And so we are going to see it as a T wave. Now, the T wave is pointing upwards, and earlier, upwards deflection on our EKG meant depolarization. So one of the difficult concepts is, why is repolarization, potassium ions moving out of the cell and the cell membrane becoming more negative, show up as a positive depolarization looking wave on the EKG? And it has to do with physics and vectors. Okay, remember, when we ask the heart to depolarize, we ask it to get to the apex and depolarize with those Purkinje fibers outward. So when we are getting cells to start repolarizing, all right, the cells that are going to start to become negative again are going to be down here, and the cells that are still depolarized are up here. I measure things in a negative to positive direction on lead 2 from right arm to left leg. I repolarize from left leg towards right arm. So the electrical change that I'm seeing, I'm measuring this way, and the electrical change is occurring from negative to positive this way. So instead of showing a T wave like this, because it's repolarizing and more negative membrane potentials are happening, I see this because what was the direction I'm measuring? Right arm to left arm. What was the repolarization happening? Left leg to right arm, so it inverts. And hopefully that is clear to my Tuesday group, which we had a good discussion, and I was probably very terrible at explaining that. Okay? All right, so the key things that you have to know, again, first wave you should see on an EKG is a P wave. The P wave represents the atrials are depolarizing. They are the SA node initiating potentially a contraction because the SA node hit threshold and started rapid influx of calcium, phase 0, action potential ion movement. Okay? It's going to spread, and you are going to see that the P wave is representative of all the atrial cells depolarizing. And again, if you look at what happens in a cardiac cycle, you should quickly in the middle of the P wave, if I can get this back on, all right, you should start to see atrial systole happen. you should start to see, again in that picture, that the pressure in the atria kind of comes up, if this is pressure. So if it's sitting at 0 millimeters of mercury, when the atria contract, what happens to the size of the atrial chamber? It squishes in, so the chamber pressure might go up to maybe 2 or 3 millimeters of mercury. And if it's 0 millimeters of mercury in the right ventricle for a pressure, how is blood going to move? From high pressure to, here's my left ventricle or my right ventricle pressure, which is still at 0, from high to low. And where will blood go? Into the right ventricle. Okay? If this is the left atria, then if it rises up to 2 or 3 millimeters of pressure and the left ventricle is at 0, where is blood going to move? Into the left ventricle. Okay? All right. The QRS complex is going to represent when my ventricle is depolarizing. Okay? So it represents that the AV node hit threshold. The AV node sent the wave of depolarization down the bundle, through the branches, through the moderator band, through the Purkinje fibers, got the ventricle contractile cells to start to depolarize, got the papillary muscles to start to depolarize, and all of those cells are now depolarizing. So again, what's going to start to happen? My AV valve should close because the papillary muscles are going to pull it. My ventricle is now going to enter systole. My semilunar valve is still closed. So for a little bit of time right here, I am going to be in a time of isovolumetric contraction. And then very quickly, the rest of this time, what are my ventricles going to be doing? Ejecting blood as they continue to contract, and the pressure in the left ventricle, all right, the pressure of the blood in the left ventricle as the ventricle is getting smaller starts to be more force on the walls and on the semilunar valve than the blood in the aorta or the blood in the pulmonary trunk, and they start to push their way out. Okay? All right, remember, I am going to start to see these cells repolarize. I am going to, with repolarization, what do ventricle cells stop doing?
So they're going to be isoventricular relaxation then?
Or, yes, that'll come somewhere around here. That's not working. All right. Somewhere around the middle of the T wave, I am going to start to see, again, some of my ventricle cells are repolarized. So if I had 100% right here, ventricle cells contracting, right around here, I'm going to start to see 90, and then 80, and then 70, and then 60, and then 50, and then 40. You see? Because what are they doing? They're repolarizing. If they repolarize, what are they going to not do anymore? Okay. Contract. And as the ventricle stops contracting, what eventually is not going to be able to be maintained? The blood in the ventricle pushing on the wall is not going to be able to keep moving out because the ventricle is beginning to relax. So somewhere around here, I am going to see my semilunar valve close, and I am going to have a period of isovolumetric relaxation. And I'm going to then, by this point, everything is, my ventricles, my AV valves are open. They are passively filling. All right. And from here to here, I am in ventricular diastole. Okay. It looks much better in the slide that had it all lined up, right? Than it does in my hot mess. Okay. So back to what does the EKG mean? The T wave represents my ventricles are repolarizing. Repolarizing means they are going back to no actin and myosin interactions. If no actin and myosin are interacting, no contraction is happening. Okay? They are beginning to go into their diastolic period. Again, once that semilunar valve closes, that means that the blood left in the ventricle, which hopefully is just a little bit, is no longer having the ability to push on the walls with enough oomph to keep ejecting out. And part of that is because the fluid has lost volume. I don't have 130 mils in there anymore. I'm maybe down to 50. The other side of it is the ventricle cells are no longer 100. Every one of them is contracting. Some of them are beginning to, like tug of war. Some of them are beginning to just walk away. And eventually you're trying to tug of war with a few cells so the semilunar valve closes. You will finish the rest of those guys repolarizing. So the little bit of deep ventricle diastolic period, the very early part, the isovolumetric relaxation is when the ventricles finish that are still contracting, finish relaxing. Finish repolarizing and finish relaxing. All right? And when they're all done depolarizing and relaxing and back to stage 4, what can the papillary muscles do? Open the AV valves up again and start to let blood come back into the ventricle. Okay? Now, the segments that you need to be aware of. Usually they talk about the P to R segment or interval. That usually is a time where we know that the atrias are going through a period of systole and then going into their diastolic period. Okay? And then you usually hear about the QT segment or interval, QT, in this hot mess. And that's usually where we know the AV valve to the apex, the conduction system is working, the ventricles are depolarizing, the ventricles are repolarizing. And so the front half of the EKG, the P wave to the QRS, that's related to what's happening between the SA node and the AV node, what's happening with the atrial cells. The QRS complex to the end of the T wave, that's what's happening between the AV node, the bundle branchers, the Purkinje fibers, and the ventricle depolarizing and repolarizing. Okay? General rule of thumb. Every P wave should be followed by a QRS complex. Okay? Every time the SA node initiates the atrias to depolarize, what do we want to happen? The ventricles follow suit. Right? Does that always happen? No. And then for some people, sometimes it's 2 or 3 P waves before they get a ventricle. And those are, again, abnormal EKGs when that starts happening. All right? As we get older, as these cells stress, the repolarization and the time of the action potential gets longer and longer. So another thing that'll start to happen again as we get older is these time periods may widen as our old decrepit cells that have been stressed have a hard time repolarizing and resetting. And so you might see with, again, sick hearts, elongated QT segments, elongated PR segments. Okay? Normally when you walk up to an EKG, you want to count the number of QRS segments, and that kind of tells you how many ventricle contractions you have, and that's how you usually then, if it's a 10-second EKG, how many contractions did they get out of their ventricle in 10 seconds? If they had, in 10 seconds, if they had 7 contractions, then what would you say their resting heart rate is laying there? 7 times 10 seconds. There's 6 10-second intervals, right? So what's 7 times 6? Okay, so they would be dead, bradycardic. Bad example. But if let's say, okay, so let's do a better math. If they had 15 beats in 10 seconds, what's 6 times 15? 90. Okay, so would you think they're okay if they're having 90 beats per minute? Yeah, especially if they're a little nervous, right? Or they're tapping their feet or kind of fidgeting a lot, right? Because I'm at, what am I at right now? I'm at 98 right now. Okay, and I'm not doing a lot of work, but, you know, fidgeting a little bit. Okay, so what you need to know, again, are what are the pieces, what are the main parts of the EKG? And so in your lab, there was that one picture. So expect to, if I point to the front wave, that would be a P wave. If I asked you, what does it represent? That represents the atrials depolarizing. If I point to the QRS complex, you know, that's the QRS complex. The QRS wave would be also acceptable. What does it represent? It represents ventricular depolarization. It's masking atrial repolarization, okay? The last wave is the T wave. What does it represent? The ventricles are repolarizing. The ventricles towards the back end of that wave should be going into diastolic period, relaxing. The AV valve should be getting ready to open. They're finishing their isovolumetric relaxation, right? What are the segments? The P to R segment, again, that time period would be what is electrically happening between the SA node, the AV node, what's happening across the atrias. The QT, that's when we know electrically things should be happening between the AV valve, the bundle branches, and the Purkinje fibers, and we should see everything happen in the ventricles. Depolarization and repolarization. Woo! Yay, that's the EKG. All right, questions from the peanut gallery? I'm going to stop the recording.